everyone who's joining us this evening. We'll just give everyone a few minutes to connect through our various social media platforms. And just want to welcome you all tonight who is being a part of this really important conversation we're having. And before we begin, I'd just like to acknowledge that I'm speaking to you from my Queen's Park office on the Treaty 13 lands of the Mississaugas of the Credit First Nation, and just want to really reaffirm our party's commitment to the truth and reconciliation process, and just to express just the gratitude I have. I've learned so much from Indigenous peoples about how to care for each other, the land, the plants, the animals, the water, that all sustains us. And so I'm very grateful for those teachings. And I'm also grateful tonight to have the opportunity to meet with all of you and talk about just a vitally important issue that's facing Ontario right now. I've had so many people reach out to my office, especially seniors and children, but also people with who access their eye care through OHIP services, concerned that those services are not available. And for over 30 years, optometrists in Ontario have been fighting for fair compensation for the services they deliver to provide eye care to people through OHIP. And it's finally reached a breaking point. And many of us, myself and other MPPs, have been speaking out, reading petitions in the legislature for well over a few years now. And the government really hasn't moved to provide fair compensation, or just to really enable optometrists to break even. And so I'm really honored tonight to have an optometrist from my riding in Guelph, Dr. Christine Main, joining us. And Dr. Main lives and practices in Guelph in the Sunny Acres neighborhood, which, for those of you who know Guelph, know it's a really beautiful neighborhood on the edge of downtown in Guelph. And Dr. Main came to Guelph to study at the University of Guelph on a scholarship, actually a president's scholarship, and then went on to the University of Waterloo, where she received her Doctor of Optometry, and then moved to Germany. I was interesting to know, and began her career in Hamburg, working for Euro Eyes. And after working in Europe for a number of years, returned to Guelph in 2014 with her husband and 4 children to set up practice in the city she loves. And she volunteers for, she has in the past volunteered for nonprofit eye hospitals in Nepal and India, as well. So you not only practice locally, but practiced globally as well. And so before we begin, I'd just like to encourage anyone, if you have any questions, feel free to ask those questions in whatever social media platform you're on in the chat to us, and we'll try to answer your questions as we go forward with this conversation. So to kick things off, I'm wondering, Dr. Main, if you could, I know I gave a bit of an introduction, but if you could just explain from an optometrist perspective the situation regarding the government's holding out on properly funding eye care in Ontario, maybe a little bit of the history and the concerns that optometrists have across the province.
Sure, thanks, Mike. So like you mentioned, we're basically facing an eye care crisis in Ontario right now. And it's because for more than 30 years, the government has neglected to negotiate with optometrists. And that means that there's continues to be a growing gap between inflation and the investment in eye care, such that the OHIP fees that we have today don't even come close to covering the cost of our office expenses. Simple things such as staff, rent, utilities, expensive equipment, and even supplies that we need to provide an eye exam. So this underfunding has in turn led to decreased access for OHIP patients for eye exams. They're the patients who need it the most, right? The seniors, the kids, and anybody with pre-existing eye disease or, for example, diabetes. These are the patients who no longer, are able to access eye care as freely, because we as optometrists can't afford to service them. Like, for example, I know many optometrists even before COVID who had a minimal amount of spots open for OHIP patients because they simply couldn't afford to see more than a handful a day. So basically, it's come to a breaking point where we as optometrists, we see this as an issue. It's not okay for these patients not to not have fair access to care. And we're standing up for these patients and their families, and we're saying, hey, this needs to be fixed. The Ontario has to stand up to step up to the plate and at least just cover our cost of delivering so that we don't have to triage anymore, and we can see the patients and give them the high quality of care that they deserve. Because let's face it, it costs money for high quality of care, expensive equipment. And if the government doesn't invest, we're not going to be able to provide that high quality of care.
Yeah, Dr. Main, you saw me in question period. I've asked the government questions on this issue and spoke at a rally. And one of the things I challenged the minister was to get her basic math correct. So I'm going to try to see if my math is correct. So it's my understanding the government reimburses optometrists around $45 to provide an OHIP eye exam. But the cost to provide that exam is around $75. And that doesn't even include, if the doctor was being paid. That's just the cost of delivering service. Is that math correct?
Yeah, it's absolutely correct. And that's not, it's interesting because you come to the same number no matter how you look at it. There's so many different ways you can look at it. The amount that we were receiving, say in 1989, before I, was even out of public school, it was, I believe, $39. All you have to do prorate that to inflation, and you come at the same number, approximately $75, just with inflation alone. If you look at the next lowest funded province in Canada, the next lowest funded would be Manitoba, and they receive what do you know, $77 for an eye exam. And then, there's another way. Then we said, okay, well, fine, we'll do an independent cost analysis. In 2019, we invited the government to participate with us, and they refused. So we did it on our own. We paid out of our own pocket. The association did this cost analysis. Guess what the cost came out for an eye exam? $75 on average for an eye exam. Of course, in Toronto, it's going to be a little bit different than in Sudbury or wherever, but still, we're, all roads lead to Rome. So we're asking the ministry, how complicated is this? When we present this to her and she tells us, oh no, we need to set up another working group to analyze the cost because we're not sure if it really costs that much to run an eye exam. It's like, seriously, right? So this is, I think, why it's come this far, that optometrists are no longer willing to talk about negotiations and willing to to working groups. We just need to be reassured that they're serious in covering our costs.
Right. And so just to be clear, I think Manitoba is $77. I believe Alberta is $126. And then Quebec, I think maybe 108 around in there. And Ontario is $45.
What's the cost of living in Ontario, right? So
exactly.
It's really unjustifiable. I think it really comes down to political pressure. So I think that the government, they really, up till now, they haven't felt the political pressure to make a change. And that's what tonight's about. And that's what our job action is about. We're so grateful for all of our patient support up till now. I've been flabbergasted, the loyalty that my patients have, how many letters they've sent personally to you, and then of course to the health. Yeah, and even the listeners tonight, that they care enough to log on and sign their, to show their support for our cause. This is what optometry needs, because we're a small profession. And, we need the public support. We need them to put pressure on the government to make a change. The more noise we can make, the louder we are, the faster this will be resolved. It's unbelievable that it's gone on this long. None of us thought the government would ever let it go on this long. And so, yeah, I'm just grateful for everybody's support. That's what we need. We just need more support to get this done.
So one way I tried to explain it in debate in the legislature was that, what business could stay in business if they charge $45 for a service that cost them $75 to deliver, or, a good, they wouldn't stay in business for very long. And so being underfunded like this for so many years, what's that meant to just how you operate your practice? How has it affected the care you provide, the service you can provide to people?
Yeah, absolutely. So, I mean, we see this so basically it means you have to see more patients, right? You have to see more patients more quickly. And that affects the quality of care. You can't do the complete thorough eye exams that you might be able to do because you're having to, but I think the biggest thing really is that we're just no longer booking those patients because we're saying, you know what, we can't afford to do that. So there just aren't the appointments that we need. And I think it's very unfortunate. You're right. In no other business or profession, I'm a professional, so it just doesn't make sense. And we thought if anybody that the Conservative government should understand, they're about small business, and but it's been every government really up till now. So yeah, it's not right. It's just not right, like you said. Let's not talk about fairness. It's just not right that this is how it's happened. This is what's going on.
Yeah, and one of the things the minister has said is, oh, well, we're offering an 8% increase, which is what we've offered to doctors. And I guess my response to that is well, 8% still means that, I guess what that would mean, you would make maybe $48 or something, and still cost you $75.
Yeah,
so I don't even understand the rationale there.
We'd still be at a loss. And when they compare us to the family doctors in Ontario, the family doctors in Ontario are the second highest paid in the province, in the country. So we're not comparing apples to apples here. So, if they would give us an 8% increase on the second highest fee in Canada for optometrists, yeah, sure, I'll take that deal. But, this 8% increase doesn't even bring us to the Manitoba's rates. So we're basically just asking for cost recovery, or basically, really, we just don't want to be the lowest funded in the country.
Yeah, and so this has been going on for 30 years. Obviously, that's been numerous governments from various political stripes. And so what is sort of, why the breaking point now? Like, why have you sort of felt like you've just hit the end of your rope this year?
So if you look at the eye exam, for example, that I'm delivering today, and you compare it to, say, 20 years ago when I graduated from optometry school, you would see that it's actually there's quite a difference there. And that's because basically, like in 2011, for example, we in our scope of care, our scope of practice was increased. So that meant that, for example, we could prescribe more drugs, we had to make more diagnoses, and that in turn took a lot of pressure off family doctors and the ophthalmologists, the medical surgeons, and even the emergency room doctors. So that was in turn, saving a lot of money for the government. And of course, they promised us that we would be appropriately reimbursed for this increase of performance of these services that we're providing. But again, we waited and nothing came of it. So I think that gradually we're seeing, we've been promised and promised again, and everyone has a breaking point where we're just finally saying enough is enough. We need to see a commitment. We need to see a commitment to cost recovery, and that's when we're willing to come to the table. I mean, the other thing is that, of course, we're a small profession, so we can't afford to go to the negotiation table if they're not serious about our asks. And I think that, it's not in good faith to just, publicly announce an 8% increase that was never formally negotiated with us. There's been very little talk, very little discussion. We just don't feel like we're being taken seriously.
Right. And, one thing I want to make clear to people listening tonight and in the future when they replay this on our social media feeds is that some people come into my office, especially seniors have come in and said, hey, here's $100. I'm willing to pay for my exam. And I just want to make it clear to people that it would actually be illegal for an optometrist to do that through the OHIP system. Like you can only fund OHIP care through OHIP. And because we don't want to see two-tier medicine in any area, eye care, any other area. So I just wanted to clear that up because some people have asked me that question. And I'm wondering, so you have, obviously a number of people in Guelph have reached out to I'm actually letters from across the province. So not just Guelph, but from people all over Ontario have been reaching out to my office. Do you have some suggestions, your patients who are concerned about access to eye care, like how they can get involved, how they can support optometrists?
Absolutely. So like I said, the more noise we make, the better. So there's a website that the association has set up. It's called saveeyecare.ca. And there it's quite simple to, even if you don't know who your MPP is, say if you were out of your district, Mike, they can send a letter. It's a form letter, mind you, to the minister and to their MPP. And what we're finding now is it's really those personal letters that are making the difference. It's the phone calls, it's the emails. So if the Green Party would be so kind as to put in the chat, I think I shared those emails and phone numbers of even Doug Ford and Christine Elliott. They need to hear that it's important to you to continue to receive quality eye care, continue to have access to that quality eye care. And the more people that write, or even, a letter to the editor, we need to raise awareness. We need to recognize this crisis on Ontario that's unique to Ontario. It really is, so that we can rectify it once and for all. And I can go back to work, what I like doing, right? I just want to help. I just want to treat my patients, and I don't want to lose money doing that. I mean, it's a crazy simple ask, really.
Yeah, no, it really is. I just wanted to, so another question's come in, or actually this time more of a comment. Somebody says kids can't learn properly with poor eyesight. Others are more vulnerable to accidents and inability to function fully, work, care for themselves and their families if they can't see properly. And I guess as an optometrist, when you hear somebody, make that observation, knowing the situation we're in Ontario right now, like, how does that make you feel?
Nobody knows that better than us, Mike, right? We see that every day, and that's what makes our job so fulfilling. And I just want you to know that we're not leaving anybody in lurch here. We are triaging patients. We are, we're finding an alternative care, whether it be their family doctor, or even dealing with emergencies ourselves, or sending them to emerge. We are looking after those patients, so that the last thing we want here is for somebody to lose vision during this job action. What really worries me the most, though, is those asymptomatic patients that there's a lot of things we pick up on a daily basis just through routine eye exams that now aren't being done. And I think the longer this goes on, it's a ticking bomb. It's just a matter of time until we have casualties. And that's why I'm, urge the government that it needs to be fixed, because we can't, it's not going to end well the longer this goes.
Yeah, another question that's come in is somebody asking if part of what has led to a bit of a breaking point now is that we have more and more baby boom generation becoming seniors, and therefore eligible for OHIP eye care, which is actually in a way like driving up your losses if you're losing money on every single one.
Yeah, exactly.
How much of that is a part of it?
Ontario's aging population is basically exposing a system that's already been unable to adapt. So, right, you're right. It's just giving extra strain onto the system. And basically, the shift in demographic is a reality, and it's not going to go away anytime soon. So all the more reason, exactly, Mike, that's why we need to be doing this now, because it'll be disastrous, right? We're basically the primary eye care doctors for all of these seniors. And if we can't afford to see them, nobody else can.
I know we're almost out of time, and if you don't mind me, I just want to shift gears and ask you a quick question just around COVID. Just if you could just maybe talk a little bit about how COVID's affected your practice, the way you care and interact with your patients. Just maybe share a bit about how the pandemic's affected you.
Yeah, so absolutely. So COVID has changed the way we practice. It's slowed us down a lot. So with all the disinfection, it's also increased our prices. Again, OHIP, we were not able to balance bill for masks or any PPE, right? That was all on us to provide that within the OHIP eye exam. And it really, the seniors at the beginning, it was all the diabetics and the seniors who were most vulnerable to COVID. So really that just the triaging that we were doing was even more severe, and it was limiting the access even more for those eye exams. So I was placing them, for example, first thing in the morning when I knew the risk of infection was lowest. I think if anything, COVID has just exacerbated the system though, but I want to make it clear that it's not due to COVID that our job action is happening. It's been the last 30 years. So, sure, demographics, COVID, all of these things add together, to really make the system fail.
One person commented that, and I don't know if you experience this in Guelph, that it's even maybe especially hard for people who live in rural communities where there's fewer optometrists. They have to travel a further distance to access care. I mean, I don't know, like Guelph, oftentimes we have people from, Wellington County who, come into Guelph. Do you find that people in rural area, or just even when you're speaking with your rural colleagues, that people in rural areas, do they find it harder to access eye care?
Well, I just know that my colleagues that I hear in rural areas are having, they practice even more medical optometry, right? Because their patients, they don't have access to like multiple surgeons or specialists. And so they're even more critical in terms of being part of that medical team. So, they need that support even more. It's important that they're recognized as part of the healthcare team, and be given fair compensation for the work that they're doing.
You have another question from somebody watching, talking about just equity issues for students, and in particular, so many students being at home and learning over the last year and a half on screen. Maybe that's straining their eyes a bit more than would have otherwise. And so are you seeing additional strain on, or additional demand for eye care, I guess, from younger
people? So actually what we're seeing a lot of, and I think it's could possibly be the future of eye care, is we're seeing a lot more dry eye, and that's a medical condition, right? It's not just an easy refraction, here's your glasses, you're good, but we're seeing a lot more dry eye due to the increased screen time. And also the increased screen time, actually, I always say to my patients, a lot of prescriptions that normally patients wouldn't need, put them on a computer for 8 hours a day, and all of a sudden that small, teeny tiny prescription makes a world of a difference. So, it's a high visual demand, it's an increased demand. So I'm finding, it's an increased need for our services. And I remember the first shutdown in COVID was so frustrating when we were declared non-essential, and I had to see all my neighbors saying, Christine, I need to see you, I can't see my computer, and they all needed computer glasses, and I couldn't help them with that. So definitely we're seeing an increase in dry eye, and need of specialty glasses. Not one pair of glasses fits every occasion, so often it's that second pair of computer glasses that is saving those patients who are on the screen all day long.
And I just we'll wrap up. I did want to give you an opportunity to emphasize a bit more just the important role that optometrists play in the healthcare system, and the role you play in maybe helping relieve pressure on the healthcare system by the services you provide your patients.
Thank you very much. We appreciate that recognition, Mike.
So, Dr. Main, thank you so much for joining us. I know you're incredibly busy. Not only are providing optometry services to your patients, but also you've been very vocal in speaking out for optometrists. And so, thank you for taking the time to join us tonight. Thank you for the service you provide people in our community, and thanks to optometrists across the province for the work they do. Somebody who I'll never forget the one day I was at Queen's Park and I looked down at my notes when I was giving a speech and everything was blurry and I couldn't figure out what was going on. So I saw my optometrist a few days later. They're like, sorry, Mike, you're aging and you're going to need progressive lenses. So I can personally attest to the great work that optometrists do, really to help all of us see better and live healthier lives. So thank you so much. And just so you know, I'm going to keep speaking out so that you at least can cover your costs, which I think is.
Thank you so much, Mike. Thank you. We need your help more than ever.
And thanks everyone for joining us tonight. Really appreciate it. Be well, be safe, and we will provide information about how you can speak out on this issue. I've been reading petitions into the legislature. Many of you have been sending them into my office, so keep doing that. And we'll keep pushing for fair, quality, properly funded eye care in Ontario. Thanks, everyone. Have a good night.
Good night.